Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hi, everybody. I'm Jessa, and I'm so happy you're here for this episode of Better Sex. I've dedicated my professional life to helping couples enjoy a fulfilling, intimate life. I believe that sex is important. Our connections to other people matter, and we're not living our life to the fullest if we aren't connecting emotionally and sexually with our partner. That's why I'm here, bringing ideas and information to help you live and love better. Hey, welcome to Better Sex. I'm so excited you're here today. I have a really important topic. We're going to talk about female sexual pain today, women's sexual pain. It's really important. It's pervasive. I see this in my practice a lot. Way too many people struggle with painful conditions, and most of them don't know what to do about it. I mean, some people don't realize that sex should never hurt, and other people, even though they realize sex shouldn't hurt, just have nowhere to go. The doctors aren't helpful. They're not finding providers that know anything about this. It seems mysterious. There's not any visible, obvious problem, and so they're struggling. And they're struggling in their relationship too, because it causes a lot of strain. If sex is not enjoyable, people often start avoiding it, or they're arguing about it, or they're confused and hurt. I mean, it goes downhill fast. So I have somebody on the show today who really specializes her practice on working with clients with sexual pain. She works with both individuals and couples. She's a marriage and family therapist. She's an ASECT certified sex therapist. And the focus of her work is on sexual pain. So I thought she'd be a perfect expert to come in and talk about the kinds of pain there are, what are the kinds of issues people face, what are the conditions that cause the pain, what are the treatment options, and how broad are the effects? You know, how can people understand what's going on and start to get relief and help immediately, really, in the sex therapy part of the work. It might take a little bit longer in the medical, physical therapy part of the work, but it's really important. So today, my guest is Maegan Megginson, and I'm delighted she's here. All right. Maegan, thank you so much for being with me today.
You're welcome. Thanks for having me on.
Yeah, I think this is such an important topic. I've been looking forward to this episode for a while because I see in my practice, like you do in yours, an awful lot of people struggling with pain.
Yes.
So I thought maybe I'd tee you up by asking you to talk about the different types of female sexual pain.
Absolutely. Well, I am so glad to be on today talking about sexual pain. It is pretty pervasive, a number of women who struggle with sexual pain. And it is really difficult to find medical providers who are trained and ready to give accurate diagnosis. So really important that women who are experiencing sexual pain be able to describe their pain accurately when they go in to see their doctors. The basic way that I describe it, I'm talking to my clients about sexual pain, is there's two main categories of pain: external pain and internal pain. So I will ask my clients to try to identify if their pain feels more external on the vulva area. And maybe just for clarification, in case there are folks who are listening to the podcast who don't know the difference between the vulva and the vagina, would it be okay if we describe that?
Oh, yeah, please.
So the vulva is the part of the genitalia that you can see from the outside, right? The lips of the vagina, what we call the introitus to the vagina, which is the area of skin right around the vaginal opening. And then you have the internal part, which is the vagina itself,
right?
The vaginal canal, if you will. And when we're dealing with sexual pain, typically the pain is either localized to the outside or to the inside. So we want to first understand, where are you feeling pain? Is it on the vulva or the external part of the genitalia, or is it inside in the vaginal canal itself?
Yeah, and so many people, of course, use vagina to refer to all of the
whole thing.
The whole thing. So
right.
If you're saying my vagina hurts, right? It's you
yes.
already may be off on the wrong foot.
Exactly. And if you're meeting with a doctor who isn't well versed in sexual pain conditions, they might not know to ask if you actually mean your vulva instead of your vagina. So if you give incorrect information right out of the gate, you're really limiting the likelihood that you're going to get an accurate diagnosis.
Yeah.
So is it pain external or is the pain internal? If the pain is external, if you feel the pain around your vulva area, if you feel it around the opening to the vagina, then we want to understand if it's nerve pain or if it's dermatological pain. So dermatological pain is the most well-known condition is called lichen sclerosis, which is you grow kind of an extra layer of tissue around the vulva that feels like a scab. It feels like a scratchy surface, and it creates a lot of pain. So dermatological really means there is something wrong with the skin. There's something happening to the skin that creates pain.
And that would be something that someone could feel, it sounds like, or see.
Exactly. Yeah. Usually those conditions are diagnosed by an exam, by a visual exam where the doctor looks at the skin, touches the skin, and can actually identify that there are some abnormalities on the skin that are creating the pain. Versus nerve pain, which you might have heard of the condition called vulvodynia or vestibulodynia.
Right.
Which actually means that there are concentrated amounts of nerve endings in the vulva or in the introitus area around the vagina that create acute pain either when they're touched or they might just hurt all of the time regardless of what you're doing.
Right. And this is not going to be visually, it's not going to be visible, right? Extra nerve endings. They're not, it's not like they stick out or something.
Yeah, that's right. And often if you have a provider who's not well versed in sexual pain conditions, they will look for dermatological issues. They won't see any. And then they might tell you, well, I don't see anything wrong. So
right.
Pain, the pain's in your head. Have a glass of wine, relax, you'll be fine.
Yeah.
Which is pretty devastating when you have nerve pain that is excruciating and prevents you from inserting a tampon, definitely prevents you from having penis-vagina intercourse. It's really excruciating pain that these women experience.
Yeah, and I've had a number of clients who even, clitoral stimulation, it doesn't have to be right around the entrance to the vagina. But, like different parts of the vulva can be sensitive.
Absolutely. Yeah. And depending on where you're feeling the pain will determine what you're diagnosed with.
Mm-hmm.
So, vestibulodynia is pain that is localized around the entrance of the vagina versus like a pudendal nerve pain, which could refer out all the way to the clitoris area. So being able to tell your doctor really specifically, this is where it hurts, this is how it hurts, is going to help them determine what condition you're actually dealing with. And it's pretty incredible how many different conditions you could have.
Yeah. Yeah. This is a slight detour, but do you know the statistics about how many women are suffering with sexual pain?
I don't know right off the top of my head. I'm sure there are some studies out there that examine that, but the research is still so new and it there's more research coming out every year, but no, I don't know that answer off the top of my head. I do a lot of collaborative work with the Oregon Health and Science University. They have a vulvar clinic where they study these conditions and treat these conditions.
Okay.
That would be a great place, just a great website to check out for more information if you wanted to find some statistics. I bet they have some good studies available on their website.
Okay, great. So we'll make sure to put that link in the show notes for people.
Perfect.
Yeah.
Mm-hmm. Also, there's a great book called When Sex Hurts, and you can get it on Amazon. And it's written by some of the leaders, the medical leaders in the field of sexual pain. And I think if you're dealing with any kind of pain, I would recommend checking out that book. And I'm sure that's chock full of statistics as well.
Yeah, and I recommend that book to basically everybody that comes in with pain. It's a fabulous resource, and
so good. Yeah,
identify where does it hurt, what kind of pain.
That's right. Yeah, helps the client, helps the patient create language around the pain. So if you're listening to this and you have pain and you don't know how to describe it, starting with this book is a great idea because it really helps you walk through. Here's what this is called. Here's how you can describe this type of pain. So yeah, I agree. Really great resource.
Yeah. Okay. And what about internal?
Yes, internal pain. So we talked about external. You want to know where it is. You want to be able to talk about how it feels. And then there's internal pain. Internal pain is often described as a deep pain that women experience with penetration. If there are some other, pudendal nerve issues that are causing internal pain. You could feel it if you're walking upstairs or if you bend over and pick up something heavy. That can create that deep sense of pain as well. But most of the time, what we're looking at is pelvic floor muscle pain, chronic pelvic tension. This is when the muscles in our pelvic floor are just chronically tight and in tension. And it's sort of like there's nowhere for them to go. So if we have healthy pelvic floor muscles, they're relaxed, they're kind of doing their job, and they're able to tense and release. Those are what like Kegel exercises do, right?
Right.
Helps you tense the muscle and release them. But if your muscle is chronically tensed, it has nowhere to go, and you just end up feeling sore and very tender to touch.
Yeah. And are you going to speak to vaginismus specifically also?
Sure. Yeah, we can talk about vaginismus.
Since we're talking about pelvic floor muscles.
Yeah, sure. So vaginismus is when the vagina, when you try to insert a finger, a tampon, a sex toy, a penis into the vaginal canal, and the muscles actually spasm closed. So a lot of women will describe this sensation as like there's like a wall, there's a barrier, there's something in my vagina that's, preventing penetration. And they often describe it as this wall or this barrier, but really it's the vaginal muscles contracting closed so that you can't penetrate or push anything inside.
Right. And most women describe that as painful.
Right.
It is a painful condition just by itself, and certainly develop in secondary to pain, right? When people expect sex to hurt, and then that, the body clenches up. So
yeah, exactly.
Yeah.
And that's how I hear it diagnosed most frequently, is secondary to something else. So secondary to sexual trauma, secondary to an external pain condition like vulvodynia, right? Because our body learns how to protect from pain.
Right.
And the muscles are great at instinctually tightening up, kind of getting ready for fight or flight, if you will.
Yeah.
Yeah. So vaginismus is very painful, very confusing, very scary, but also very easy to treat. So I feel a bit of relief when the diagnosis is vaginismus.
I do too. I tell my clients, it's like the good news is this is completely treatable.
Yes.
It's just a matter of how long it might take. So,
that's right. Mm-hmm. Yeah. And then a couple other causes of pain. I mean, we're talking mostly about organic causes of pain, right? Like things like something kind of goes wrong in the body that is outside of our control. It just happens to us. But then there are also pain. We develop pain from things like sexual trauma, which I said a second ago. So if you experience a sexual trauma, you can develop pain from the chronic tension that results after the trauma. And then a lot of women develop what we call postpartum dyspareunia, which means basically your vagina starts to hurt after you push a baby out of it, which makes a lot of sense.
Yeah.
But we want to look at, was there tearing? What happened to your pelvic floor muscles? Have you regained your core strength since you had that baby? So lots of different origins of pain, lots of different types of pain. And the first thing that I do with my clients is to communicate very clearly, sex should never be painful.
Yeah.
Ever.
Yeah.
Sex should never be painful. And if you are feeling any kind of pain, we need to identify where you're feeling it, what's happening, what it feels like, and then we need to make an appropriate referral to figure out exactly what we need to do to treat the pain.
Yeah. I'm thinking of a couple other kinds of issues that I see that cause pain, and maybe we can't list them all, but, endometriosis comes to mind in terms of a deep internal pain.
Yeah.
Things like chronic yeast infections, or bacterial infections, something going on with the flora and fauna of the environment cause pain. But then I'm also thinking about the people that come in and have pain because they're just not aroused. I mean, I do want to just point that out.
Yes, absolutely. Lack of lubrication.
Right. So they're not aroused. They're not lubricated. They're not getting the stimulation of foreplay, is what people would call it, that they need to be aroused. So it's I don't want everyone thinking if they have pain, they automatically have some sort of condition. It could be something simpler.
Yeah, absolutely. You're right. It could be as simple as you shouldn't be trying to penetrate yet. Your body's not ready. The blood's not pumping. Maybe you're not using extra lubricant. Absolutely. And menopause, many women who are going through menopause experience vaginal atrophy, which is a really scary word.
Yeah, it's a horrible term.
It's a terrible word, but I want people to know the word, right? Because that's the word the medical professional is going to use. So she'll look in the vaginal canal and see if any of the tissue is thinning out, drying out. And the thinner and drier our vulva tissue and our vaginal tissue is, the more painful it's going to be when we rub something up against it.
Right.
Yeah.
All right. I think we've covered everything I can think of so far.
Yeah. Lots of different causes of pain.
Types of pain. Yeah. And that's the thing when you, like, especially reading that book, how many different causes there are and how complicated it can be to get to the root of it.
Mm-hmm. Yes. And we're at a huge disadvantage because, even gynecologists are not well trained in sexual pain conditions.
Yeah.
So we really have to be our own best advocate when we're trying to get treatment for a pain that we know is real.
Yeah. Yeah. I mean, for goodness, they're not necessarily trained in sexual functioning in general, right? Making babies and stuff. Yes. So, and then when you have the complication of sexual pain, right? That's, I think, where they say, just have a glass of wine or just relax and don't know what to do with it.
Yeah, take a bubble bath and don't be so stressed out. Like, thanks, doctor.
Right. So that leads into my next question, which is what kind of issues do women find it when they're seeking help and information about their experience, right?
Yeah. The statistic is, on average, women see 7 different doctors before they get an accurate diagnosis for their pain.
Wow.
Which is
shameful.
So many doctors. That is so many doctors. I mean, can you imagine going to 7 different appointments where you're describing the same thing?
Well, and something that's so, I guess I want to say personal, but so essential to our, I don't know, that it's so painful, and I don't mean that physically painful, emotionally painful to struggle with this and have to go to describe that to 7 different people.
Right. It's humiliating.
6 of whom may be not getting you any closer to an answer.
That's right. And not only are those doctors not getting you closer to an answer, but they're actively shaming you and telling you that the pain you're feeling isn't real. And that's what's most painful to me.
Yeah.
I can't think off the top of my head of a single client I've worked with who hasn't had at least one shameful experience with a healthcare provider about her pain.
Yeah.
And they mean well. And I know there aren't, millions of doctors out there who wake up in the morning excited to shame women about their sexual pain.
No, of course not. Yeah.
But it is a pervasive problem that prevents, I can't even imagine how many women it prevents from getting the care they need to resolve this pain.
Yeah.
So that's the biggest limitation, is lack of training amongst medical providers about the cause, the origin, and treatment for sexual pain conditions. So I like to help my clients prepare as best they can to go into that doctor, with the When Sex Hurts book. Have that book in hand, have any research you've done in hand, and, be able to sit down and say, this is my pain, this is what I'm feeling, this is what I believe it is. And don't take it's all in your head for an answer.
Yeah. And I think we're also up against people not realizing that sex shouldn't hurt.
Right.
Right. Like, I mean, they're not talking to people about this or even seeking help because they think this is just the way it is.
Oh, absolutely.
They may have been taught that sex hurts, or they just, have that belief.
Absolutely. I hear that all the time. Well, I'll say, well, how long have you had this pain? I don't know, since the beginning.
Yeah.
Since the beginning, that's not normal. That's not okay. And just the look of puzzlement on their face. Like, what do you mean that's not okay? Sex just hurts.
Right.
It's just painful. No, it should never be painful. And it doesn't have to be painful.
Right. Right.
Yeah.
Hi, it's Jessa. We're just going to take a quick pause here, or a little breather in the middle of the show. Thanks for listening so far. I'm wondering if you have a question that you want me to answer on a future episode. You can actually record a question for me at our website, bettersexpodcast.com. You're going to find the recorder on the footer of every page and on the side of the episode posts. And if I choose your question, I'll play it on the air and answer it as part of the show. I'd love to hear from you.
So how does the pain affect a woman's overall health, quality of life? I mean, of course it does, right?
Sexual pain impacts every facet of our life. Sexual pain does not just impact sexual functioning. And this is something I talk with, all the time, with clients, with medical providers, just trying to spread the word that, our sexuality is a core part of our humanity. And when we're dealing with something as shaming and isolating as sexual pain, there's no way that it's not going to impact other areas of our life. For example, psychologically, the way we view ourselves when we're feeling sexual pain, the words that I hear most often in my office, I'm sure you hear them as well, is I feel broken and I feel defective.
Yep.
Like there's something wrong with me.
Yeah. It's heartbreaking.
it's so heartbreaking. And if you're walking around with this view of self, if you view yourself as broken and defective, that is going to have an incredible impact on so many areas of your life. Your emotional health, if you have this negative view of self, you're more likely to be depressed, you're more likely to be anxious, you're more likely to isolate yourself from friends and family because they don't understand this pain and you feel misunderstood or shamed. It impacts your relationship. I mean, the list goes on and on, right?
Yeah. And it's going to impact your ability to go get help too, right? Because it takes a certain kind of distance to go through, up to 7 doctors and to take it seriously. And if they're not doing it for you, you've got to do that yourself. And that's hard if you're feeling broken.
It's hard if you're feeling broken, and we're just really busy.
Yeah.
Right? It's like we already have like 2 million things on our to-do lists. And if, we see doctor number 2 and they tell us the same thing, besides feeling broken, we're probably going to give up because we just don't have the time
to
continue advocating for ourselves in this way.
Right. Or even the hope that there's an answer. If 2 doctors tell you this is just the way it is, that's a hard hill to climb.
That's right. A lot of women accept that as truth. If more than one medical professional tells me that it's all in my head and I just need to relax, at what point do I believe that?
Yeah.
And often I'll see clients in my office for couples therapy, and they come in for, communication problems. And then I ask, how's your sex life? And they'll say, we actually don't have a lot of sex. And eventually I'll ask the female if she ever has pain. And she'd be like, oh yeah, I've had pain forever, but the doctors told me it was no big deal. So it's not until they circle back around to sex therapy that they actually find someone who is knowledgeable in the actual origin of their pain.
Yeah. Yeah. And of course, it has a huge impact on the relationship because, first of all, who wants to have sex if it hurts? And then that whole sense of self, too. I figure I see so many couples where they're backing off of sex, they're avoiding it, they avoid talking about it. There's not open communication because there's just this fundamental sense that something is flawed.
That's right. Something is flawed and this doesn't work.
Yeah.
Sex isn't working for us.
Yeah. What are the other kinds of impacts you see of pain within the intimate relationship?
Within that primary relationship. So I am trained in emotionally focused couples therapy. So that's kind of the lens through which I work with couples. And basically what that means for people who aren't familiar with emotionally focused couples therapy, that means that I help couples understand the patterns of communication that keep them emotionally disconnected. And I try to help couples kind of dig deeper into their emotional needs to learn how to communicate with each other more vulnerably, create more deep and meaningful connection in the relationship. And what I find as a couples and sex therapist is that there are often 2 layers of the relationship that are being impacted by sexual pain. Obviously, there's the sexual layer and whatever that looks like for the couple. So, some couples might start avoiding sex altogether. Some couples might try to push through it because they don't believe that it's real or they don't believe it should be happening. But as a couple experiences more and more distress in their sexual relationship, their emotional relationship is impacted in a really big way. So maybe they don't feel close and connected anymore. Like sex used to be a way that they really bonded and felt attached to each other. And now that's gone. So they're fighting more. There's more tension. It's like the 2 things sort of perpetuate each other. And if neither one is going well, the relationship just keeps spiraling until the couple gets to a point of crisis.
Yeah. And I see, if the partner doesn't quite believe the pain, because it's not something visible, there's no blood or, that makes a certain kind of damage. But if they also struggle if they see the pain, right? Like if they can tell it's painful, that's right. That person is way less interested in having sex or.
Yeah. I hear partners all the time talk about feeling like perpetrators.
Yeah.
Which is a really painful discussion to have. But, there definitely are dynamics where the partner with the sexual pain is the partner who's pursuing for sex. Like, just ignore it. The doctor said it's not real. I just want to push through it. I want to keep having sex. And it's partner B. It's the partner without the sexual pain who's saying, no, I don't want to do this. I feel like a perpetrator when I'm trying to have sex with you and it's creating pain. So the resistance around sex can come from either partner, the partner with or without sexual pain.
Yeah, absolutely. And the pain, it just seems like the pain is, becomes sort of the elephant in the room. It gets bigger and bigger, and it's like another player in the relationship.
Absolutely. It's another player in the relationship, and it's a player that nobody understands.
Yeah.
So eventually they just stop talking about it, right? Because we don't have any solutions to this problem. Let's just pretend like it's not there, but we're still kind of dancing around the elephant in the room. It becomes incredibly complex.
Yeah. So what are some of the treatment options? I mean, where do people even find help? What should they consider? What are some of the options for the various conditions that cause pain?
Absolutely. So I would first start by finding a sexual health informed gynecologist or OB-GYN. And the way that I suss out who is informed, sexual health informed and who isn't, is by making a phone call to the front desk and asking, what kind of training does Dr. So-and-so have in sexual health? Is Dr. So-and-so sex positive? How do they demonstrate that in their practice? Like, patients should feel empowered to interview their providers and select the provider who has a track record of treating sexual health concerns.
Yeah. And I suppose people could also look at the ASECT website for any OBGYNs that are ASECT certified sexuality counselors.
That's a great point.
Which are for the medical providers who could have, will have demonstrated, that they've gone through a bunch of training and supervision to be specifically working around sexual health and function.
Yeah. I think that's a great place to start. And I would say don't get discouraged if there's no one in your area or no one in your state even. I start there. And then if you don't find someone, pull out a list of all of the gynecologists who are covered under your insurance plan and then start making phone calls.
Right.
And asking these questions until you talk with someone who says, like, yes, absolutely, Dr. So-and-so treats sexual pain conditions. She's familiar with the latest treatment options. So that's my number one piece of advice is do research before you walk into this room.
Yeah.
Before you ever schedule an appointment with this doctor, do some background to make sure they are someone who's going to know a little bit about sexual health and sexual pain.
Yeah.
Here in Oregon, we have I think I mentioned it earlier, we have a great center for women's health and particularly a center for vulvar pain conditions. And we are really practicing a triangle treatment approach. So the triangle treatment approach is, obviously, there's 3 points. Point one is to get a medical provider who is trained in sexual pain conditions. Point two is to get a pelvic floor physical therapist. So a physical therapist who is trained in working with the pelvic floor muscles. So this is particularly helpful for women who have vaginismus, pelvic floor pain, any kind of like chronic tension. And then the third point of the triangle is psychotherapy.
Right.
Finding a certified sex therapist who knows about sexual pain and knows how to treat sexual pain. The collaborative approach between those 3 points of the triangle is proving to be most beneficial for clients with sexual pain.
Yeah. And I don't know if there's another kind of condition that really needs a triangle, a team approach as much as pain does.
Yeah, I mean, I'm sure there might be, but I don't know any off the top of my head.
Yeah,
right?
To me, that's the one that you just have to. And we did do an episode with a physical therapist, a pelvic floor therapist. So that was played already. But all 3 of those legs are so important because the physical therapist is doing that exercises and body work and biofeedback and all that stuff. The doctor's doing the diagnosis and medical treatment, and then the sex therapy piece is really critical for the people, for the emotional support around this.
Right.
More information but the relationship dynamics, I mean, that part can't get tended anywhere else.
I mean, it comes back to what we were talking about earlier, that sexual pain can impact every other facet of your life.
Yeah.
Often what I find working with clients with sexual pain is that this pain has really become a trauma in their life. And I don't use that word lightly.
Yeah.
I really do mean that this pain has created a complex traumatic experience. And complex trauma means, something very painful and scary happens over and over and over and over and over again. And women who have been dealing with pain for a long time do have symptoms of PTSD and do struggle with trauma. And the psychotherapy office is the space to heal that pain and to begin to heal the emotional self so that the work you're doing with the doctor and with the PT will actually result in you having a healthy sex life again.
Yeah.
And I see that in a lot of women. They do the work with the doctor and the PT, which is great. But then they feel super ashamed because they don't want to have sex again. The trauma is still present.
Right.
So you're right. If you don't have all 3 points of the triangle, you're probably not going to really heal in a holistic way from this emotionally and physically painful experience that you've had for so many years.
Right. And I work a lot, you probably do too, with couples in this situation. So how can they enjoy pleasure in the meantime while they're still working on the pain? And how can they process this together and not have it affect their communication and their overall relationship? Yes. Yeah. And then how can they introduce sex again once the pain is being resolved? I mean, that's that can be a struggle too. So
absolutely.
Crucial.
Yeah. And that's part of what I love about being a sex therapist is we don't have to wait until medical treatment is complete before we can make tremendous progress in the relationship. Like we can start making progress from day one.
Absolutely.
And that's something that medical providers can't always offer you. They can't always offer you relief, right away, but we can.
Yeah.
So I just feel like it's such like working with people like us, working with sex therapists, I see it every day. It can create such a profound impact on how you feel about yourself, how you feel about your partner, how you feel about your body, how you feel about pleasure. And that's what makes life worth living at the end of the day.
Right. Right. Yeah. It's such a relief for people when it's like, oh, we don't have to wait and we can change things now.
We can make things better today. Yeah. It's an incredible feeling.
It is. Yeah. It is. Well, tell the listeners just a little bit about you and where they can learn more about you.
Sure.
I don't know how many will be in Portland, but
Yeah, no problem.
Whatever you want to let people know so that they can find out more.
Absolutely. So my name is Maegan Megginson. I own a group psychotherapy practice in Portland, Oregon called the Center for Couples and Sex Therapy. And our mission is to integrate couples therapy and sex therapy because most couples therapists aren't trained in sex therapy, and there are some sex therapists who aren't trained in couples therapy.
Right.
And when I'm working with couples, I find, just the most incredible healing, the most incredible changes happen when you're working with someone who's good at both. So that's my mission, is to work with clients, to do great work with clients who are struggling with their sexual and emotional relationship. And I also love training therapists and doing this work too, so that we can really create a ripple effect out into the world. You can visit my website. I think we'll include that in the show notes.
Absolutely. Yeah.
Happy to talk with anyone in the state of Oregon who, is looking for someone trained in couples and sex therapy. But I'm also here as a resource for anyone who has questions or needs guidance about finding a good medical provider or finding a good psychotherapist.
Wonderful. Well, thank you so much for being with me today.
Thank you for having me.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get to know you and question and answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.